syndrome. This is a genetic disorder that mainly affects connective tissue, mainly collagen in the body. So collagen structure, we have to understand that why collagen structure is important. So in this scenario here, so we can see if your genetic mutation is hindered, if your genetic makeup of making collagen is hindered in any way, then your tendons are hindered. And not just your tendons, but so many other facets of your body are affected because of collagen is not being produced correctly in your body. And there's so many signs, and there's so many symptoms of EDS. So there's a lot of complaints of loose joints, like this. This would be you're very, very flexible, elasticity of the skin, stretchy skin, easy bruising. So I also mentioned hypermobility, which is flexibility. Dislocation of joints is also not uncommon. It's actually very, very common and one of the telltale signs of EDS. So if a person has any of these, they should really get it checked out. There's also complaints of cardiac issues, heart valve problems. Checking for EDS. So let's say a person is able to do these or a variation of one of these hypermobile stretches, then they might be diagnosed with it. The next picture is of a 7-year-old girl, so let me warn you that she's able to contort her fingers and her ankle in a way, so it might be a little disorienting. In 3, 2, 1. So this is actually from a study. She actually has a heart valve disease, an unreported feature in Ehlers-Danlos syndrome. It's a great study actually from 2012, but we need more research into it. But as you can see, she's able to contort her fingers in a way, and her ankle in a way that actually falls under the EDS symptoms. Treatments: braces, joint braces, Velcro tapes, such as this, Velcro taped braces. I'm not sure what a better word for these are. However, aside from body braces, there's physical therapy as well as pain medication. And, you could always be in a wheelchair or a crutch, but it's a very debilitating disorder to have, pain-wise, as well as to live with. Lastly, let's understand the histology of faulty collagen. So this is from a dog. This one right here, the big one is from a 7-month-old dog that unfortunately passed away. This is from the dermis of his skin, and you could see the faulty collagen. It's irregular. There's not much of a rhythm in how the collagen is formed. And then this one right here in our upper left, this is from a control dog from his dermis, and we could see that there is general cohesiveness in how the collagen is formed in the dermis. And this is EDS in a nutshell from what we understand from the outside. There has to be more studies and research in order to figure out how to help and accommodate people with EDS. Thank you so much for listening.